Hi, I'm Art Caplan. I'm at the Division of Medical Ethics at NYU's Grossman School of Medicine. Well, I'd like to present you today with a case that raised a lot of discussion and debate. I got involved as a consultant, ethics consultant on the case, and I think you'll find it very interesting. And I also think there are going to be some differences of opinion about how to manage the case, and I'll be looking forward to getting comment and feedback on this. The case involved a 14-year-old boy who had been brought into the hospital by his parents suffering from severe bouts of anxiety, just almost overwhelming to him. And when he was brought in, he was assigned a healthcare provider who had a West African last name. Prior to meeting the patient, I have to say that the father of this kid had basically told the intake department nurse and requested someone else. He saw the name, he hadn't even met the provider, and he said he wanted someone who might be Catholic. The parents are both from the Dominican Republic. They identified as white, but they appeared to be non white Latinx to the nurse who was doing some of the initial intake. They got reassigned to a different provider in the department who identified as African American. Well, the first month of treatment for the young boy went very well, and he seemed to be getting along extremely well with his provider. He was reporting relief to both parents of some of his anxiety, and the provider felt very connected to the child. A good doctor patient alliance had been formed. Nevertheless, at the end of the first month, the father connected back to the hospital to one of the administrators and complained, saying he still wanted a different provider. When asked why, he said, "Well, I don't really want to answer that," but getting pressed, he basically said he wasn't comfortable with having an African American doctor take care of his child. He eventually went back to the argument that what he wanted was someone with a Catholic background, although I don't know that he knew whether this particular provider was religious or was Catholic or anything else. So the issue became what to do in the face of these continued demands by the dad for a change. Some people felt that as the father in charge of the child's care, if we could accommodate what he wanted in terms of the parents being comfortable, then that's something we should do. I absolutely did not agree. My view is in a situation where a strong provider patient relationship has been established, where trust is going both ways, where there are no issues coming up between this 14-year-old and the provider, and when a serious mental health issue is being adequately addressed, the patient's interests must come first. Once that therapeutic alliance had been established and both the patient and the provider felt satisfied, I don't think the father's wishes made any sense. He may have been acting more out of bigotry or just discomfort about difference in terms of who the provider was. I don't think that's something that any health system should have to accommodate unless it is getting in the way of patient care. I hope that we treat all physicians as properly trained to deal with all kinds of patients, regardless of their religion or their ethnicity or their skin color. They should have the skills to manage and do well with any patient. There may be situations where it just doesn't work, where people don't get along. And yes, I think we should try then perhaps to shift the doctor or get a different nurse or have someone doing an exam who might be a different person. But that's because of the inability to get the patient's interests, health interests advanced. Listening to this dad about what he preferred in terms of religion or ethnicity seemed to me to be interfering with medical success. Could I stop him from moving this patient out entirely from the care setting? Probably not. But I think the way to manage this is to try to talk to him, and by the way, to talk to the mother. And when we did bring the mom into the situation, she was very happy with the healthcare provider, didn't agree with the dad and wanted to have a meeting with the social worker, the dad and her, to get him to get over the worries, concerns, and maybe even biases he was bringing in about the kind of provider he wanted. And that's exactly what we did. So I know there are many instances where patients may say, I don't want a particular doctor of a particular type. My view is we don't accommodate that. We say our doctors are trained to help and care for all manner of people. And unless we could think of some reason that there might be a gap or a problem in the actual delivery of the quality of care, we basically are not going to accommodate racism, bigotry, or bias. And we certainly shouldn't be accommodating that once a successful therapeutic relationship is established. And even when it's a child, I would argue the priority of patient best interest has to trump parental desires, parental worries, parental concerns about the background and ethnicity and religion of the provider. I'm Art Caplan at the Division of Medical Ethics at NYU's Grossman School of Medicine. Thanks for watching.